Crisis intervention in psychosis. Definition: Kaplan in 1964 initially defined a crisis as occurring when individuals are confronted with problems that cannot be solved. These irresolvable issues result in an increase in tension, signs of anxiety, a subsequent state of emotional unrest, and an inability to function for extended periods. Crisis in psychosis: a psychotic breakdown in any nervous breakdown that triggers symptoms of psychosis, which refers to losing touch with reality. Psychosis is more often associated with very serious mental illnesses like schizophrenia, but anyone can experience these symptoms if stress becomes overwhelming, triggering a breakdown. How to identify crisis? How can we identify if a person is in crisis or not? The person will have difficulty in concentrating, depressed mood, sleeping too much or not enough. The person will have anxiety, suspiciousness, withdrawal from family and friends, delusions, hallucinations, disorganized speech such as switching topics erratically, depression, suicidal thoughts or actions. These all symptoms will be present if a person is in crisis. How can we assess if a person is in crisis? Basic assessment of crisis. There are three primary methods of assessing client in crisis: standardized inventories, journal personality test, interpreted in the light of the crisis, and client interviews. The interview is the most commonly used method. These are the methods which we can use to assess the crisis. Crisis management at home. Avoid arguing with the person about what they are being paranoid about. Let them know you can understand why they would feel afraid, given the things they are thinking. Show them with your body language that you are on the same side. Example: sit beside rather than in front of them. Stay calm. Encourage your young person to use strategies they have learned through therapy. Suggest that your young person engages in an activity that will distract them from the symptom, such as watching TV or listening to music, talking with a family member or friend, exercise like cycling, swimming, using a relaxation technique. Physical abuse or threat of violence, punching a wall, breaking or throwing items should never be tolerated. If your family member is showing aggression, give a firm command such as please stop. Give them space. If practical, move to quieter, more open surroundings. Crisis intervention. Crisis intervention management will depend on the severity and causes of the crisis as well as the individual circumstances of the patient. Many relatively minor crises can be managed by providing friendly support in primary care without referral. However, more severe crises will require referral to counselors or the local mental health team. Crisis therapy includes short-term behavior, cognitive therapy, and counseling. Involvement of family and other key social networks are very important. The risk of suicide and self-harm must be assessed at presentation and each review. The aims of treatment are to reduce distress, help to solve problems, avoid maladaptive coping strategies that are self-harm, improve problem-solving strategies. Restraints. Any method or device that restricts a patient's freedom of movement, physical activity, or normal access to his or her body to ensure his/her safety is known as restraint. There are two types of restraint. The first one is physical restraint and the second one is chemical restraint. In physical restraint, any manual method or mechanical device that immobilizes or reduces the ability of a patient to move his or her extremities, body or head freely, and which he and she cannot easily remove. Never restrain a patient in the prone position. It is to avoid positional asphyxia. Next is chemical restraints. Any medication used to restrict a patient's freedom of movement or used for the emergency control of behavior and is not a standard treatment or dosage for the patient's medical or psychiatric condition. The drugs used in chemical restraints are benzodiazepine, olanzapine, haloperidol, midazolam. Policy of restraints. Restraint may only be used to ensure the immediate physical safety of the patient, staff, or others and must be discontinued at the earliest possible time. Alternative and non-physical interventions are attempted prior to use of restraints. First, patient rights. When restraints are deemed necessary, such activity will be undertaken in a manner that protects the patient's health and safety and preserves his or her life, her dignity, rights and well-being. Restraints will be used for medical necessity only and not as a mean of coercion, discipline, convenience or retaliation. Each patient will be respected as an individual. Second, staff will monitor and meet the patient needs while in restraints. Staff will reassess and encourage release from restraints. The patient and family will be encouraged to participate in care and receive education as appropriate. Provide for safe application and removal of restraint by qualified staff authorized to do so and whose competencies have been validated. Procedure of restraint. Alternative to restraint use, assessment and the decision to use restraints, selecting the least restrictive type, safe application of restraints, restraint order, violent or self-destructive behavior. Reassessment and monitoring. Patient and family education is very important. Discontinuation if restraint is not further required, and documentation. Role of nursing professionals. Role of nurse. First is assessment, planning, intervention and evaluation. The assessment process attempts to answer the questions such as what has happened, identification of problem, who is involved in the crisis, what is the cause that the crisis has occurred, how serious is the problem. The crisis worker determines the following during the assessment process. Onset of the crisis, how the crisis has started. Precipitating factors including who, what, when and where of the situation. Therapeutic interventions depends on pre-listing skills, the creativity and flexibility of the crisis worker and rapidity of the person's response. The crisis worker helps the person to establish an intellectual understanding of the crisis by noting the relationship between the precipitating factor and the crisis. The nurse plans the intervention to teach the patient how to avoid other similar crises in the future. Example, the nurse helps the patient to identify the feelings, thoughts and behavior experienced following the stressful event. During the evaluation period, the nurse and the patient summarize what has occurred during the intervention. The review what the individual has learned and anticipate how he or she will respond in the future. A determination is made regarding follow-up therapy if needed. The nurse provides referral information. Prevention of crisis. Anticipate and have a plan if crisis occur. Respond immediately. Do not overtalk. Always tell the truth. Accept responsibility. Select the right spokesperson. Show compassion and remorse. Build your reputation before a crisis occurs. Listen the person who is in crisis. We have dealt the crisis intervention in psychosis. Thank you.